Assalamualaikum everyone. Thank you, Dr. Madhi, for giving me an opportunity again for talking about the infection control, prevention and control recommendations for patients with with novel coronavirus. So in my lecture, my main objectives would be to show or to demonstrate how to wear appropriate PPE and what kind of PPE to be worn to perform hand hygiene and the donning and the doffing techniques. So with this, we could safely and confidently connect with COVID-19. So according to the CDC guidelines, definitely you need to follow the following precautions, which include standard precautions, contact precautions, airborne, which includes even eye protection. So this is definitely a droplet borne infection, which mainly spreads by droplets. However, in case of aerosol generating procedures, which I will be talking about, you need to use your airborne precautions, which includes your N95 mask and the face protection. So to start with, as everyone knows, hand washing is the most important and the easiest method to reduce the transmission of pathogens. However, the soap and water is the most important thing. If you don't have it available, you can go for alcohol hand rub or the sanitizers, which are readily available. And it is important that they have a certain percent, that is 60 to 70% of alcohol in them. Now, when you do your hand hygiene is during your 5 moments, which is before you actually encounter a patient or you touch a patient, before you do any clean or aseptic technique, after you come in contact with any body fluids of the patient, after you finish touching your patient, or after you have touched any patient's surroundings. So these are the 5 moments when you need to do your hand hygiene. Now, the various steps of doing hand hygiene as depicted here, it's very easy to demonstrate rather than to describe. However, this is the WHO sequence that we generally have to follow. So make sure you follow these steps, which includes taking a handful of amount of the alcohol hand rub onto your palm. The first step includes rubbing palm to palm, and then the second is rubbing the palm to dorsum of the hand and vice versa. Third is with your fingers interlaced. So whenever you're doing these steps, make sure you apply appropriate friction so as to you need to apply friction so as to clean your hands or to do these steps appropriately. 4 is to rub your back of the fingers to the palm, then grasping the web space of your thumb, you clean your thumb, and then your tips or the pulp of the fingers onto your palm in a rotating motion forward and backwards. And the last would be your wrist. However, there are certain prerequisites that you need to meet before you go about doing your hand wash or your hand hygiene. This is making sure that your nails are cut, all your jewelry is removed, or you remove all your wrist watches, gadgets, everything, and also make sure that your wrist is exposed. So these are very important, especially before you go about doing your hand hygiene. Now, the duration of hand rub, if you're using hand rub, it is 20 to 30 seconds. If you're washing your hand, it has to be double the time, which is 40 to 60 seconds. And when exactly would you prefer to wash your hand is when you have your hands soiled with blood or body secretions, okay? So this is when you actually, it is really indicated to wash your hand. Otherwise, alcohol hand rub can do the job. Now, as healthcare professionals, it is also very important that you get your N95 fit tested. I would like to emphasize the need for the N95 fit test. In case you need to get your N95 fit test, please do let us know so that we can arrange it for you or facilitate it for you. The right side, on your right, is what is called the PAPR or the Powered Air Purified Respirator. This is worn especially if you have failed N95 fit test for all the sizes that are available, or in case of physicians who have beards. So this is what is required if you have failed your N95 fit test. However, it is very, very important to emphasize the appropriate size of the mask to be worn. And in case of non-availability, this is why we tell you to get yourself tested for more than one size, so that if one is not available, you can make use of the other. So there are some basic etiquettes that you need to follow. You need to avoid touching your eyes, your nose, mouth with unwashed hands. Make sure once you wear your PPE, your hands don't go trying to adjust your PPEs or trying to touch the front surface of your PPE, which is already contaminated. The other thing is, of course, cough etiquette, which means covering your nose and mouth with a tissue after you cough and disposing the tissue in the nearest receptacle. And once you are done with this, you need to do your hand hygiene. The other thing is when you don't have a tissue, you could sneeze on or cough onto your elbow. However, make sure that you do your hand hygiene after you do this. So this was a circular that was put up in our Outlook regarding what PPE you need to wear. So it is very, very important for us to know what are the PPEs and what are their indications and what type of masks need to be worn when has to be clear. So at all triage points or entry into the hospital, is important for you to put on your surgical mask. The surgical mask helps you to contain your secretions, to contain your cough, thereby acting as a source control. The second thing is when you are caring for a patient or just transporting a patient, it is important that you wear the following PPE, which includes your face protection. A surgical mask is good enough if you are just caring for a patient. If you're just planning to enter into the room or not doing any aerosol generating procedure, it is a surgical mask is good enough. And then you can wear your gloves and also your yellow gown or the non-surgical gown. Now, when you are doing an aerosol generating procedure, it is very important for you to put on your surgical gown. The aerosol generating procedures, I will make a mention of what they are. Especially intubation, it is important that you wear your surgical gown, you wear your N95 respirators, your face protection, and your gloves. Okay, so you could also make use of Ebola suits, as these are very limited in numbers. These are specified only to be used for intubation and for aerosol generating procedures. Now, it is very, very important for you to avoid any contamination of your clothing, to be knowing how exactly you put on your PPEs and how you remove them. We follow the CDC recommendations. So before you put on your PPE, it is important that you do your hand hygiene with alcohol rub. Again, the hand hygiene needs to be done for not less than 20 seconds. It has to be done for longer than 20 seconds. Once you're done with this step, make sure that you are in your scrub suits. Always when you are in the COVID areas, try to ensure that you are in your scrubs. Never carry the same clothing back home or to any other area. So it's very important to dedicate your clothes or scrubs for the care of the COVID, in case you are in care of the COVID area or in case of COVID patients. So the next thing you wear after you do your hand hygiene is, of course, wearing a gown. The purpose of wearing the gown is to cover your entire clothing or your attire from and protecting yourself from any splashes that could be generated in the patient area. So you need to put on the gown, make sure that you secure the ties at the nape of the neck as well as the waist. The second thing is the mask. Of course, if you're wearing a surgical mask, make sure that it is a triple layer mask with a metal end, which is the upper end of the mask. And you make sure you tie the ties above the ear, which is at the crown, and another one at the nape of the neck. So always make sure that it is not dangling, or you don't wear it as if, it has to cover, the purpose of it needs to be met. Like it has to cover your nose, your mouth, and reach up to your chin. And by doing so, you are preventing yourself from exposure of your mucous membranes to any virus. So the third is, of course, you will have to wear your goggles. If you're wearing your spectacles, these do not act as a substitute for goggles, so make sure you also wear the goggles. Fourth is, of course, you wear your gloves. And when you wear your gloves, make sure that it reaches above or extends up to the cuff of your sleeves. So these are the PPEs that you need to wear and the proper sequence. This will be posted in the group for your reference. And it is also important that you have an assistant. If it is possible to have an assistant with you, it is always important for someone to remind you, to verify what PPE you are wearing, and once you are worn, to correct you if you haven't worn it properly. So an assistant or a buddy is always recommended. Now, how you remove your PPE is also very, very important. You need some time in removing this, and it has to be carefully removed or gently removed, not to be rash or to just, peel it off. So as you all know, the most contaminated part is the gloves now. So you would go close to the medical waste container. You will remove it gently with a pinched technique or glove in glove technique. You will pinch the glove and remove one glove and slide the other finger within the other glove and try to remove it in toto. Now, once you do this, you put it in the medical waste. Remember, all the waste that is generated from a COVID patient goes into the yellow container or the medical waste container. And there are certain things, the PPE, all your PPE will be removed inside the isolation room. Remember, except your N95 mask, which needs to be removed outside the room. Now, once you are done with the glove, you do your hand hygiene. So in the doffing sequence, it is very important for you to follow your hand hygiene after every step of your removal of PPE. Now, following the gloves, you go on to remove your goggles. You slightly bend your neck forwards, you remove it, or you hold it only by the handle, not touching or taking care not to touch the front surface of your goggles, which are contaminated. Once you're done with it, you put it into the waste, the medical waste receptacle, and you will try to do your hand hygiene. The third is, of course, the gown. When you're removing the gown, be very gentle. Untie the gown very gently from the back by removing the ties, and you try to remove it inside out, okay, such that you do not touch the outer surface. You gently roll it into a bundle and then you discard it. And the last is the respirator, which is an N95 respirator. Never touch the front surface of the respirator because it is already contaminated. You grasp the bottom end of the N95 mask and you remove it gently, and then take hold of the upper string and then put it into the waste container, which is provided outside the room. So once you do this, you need to do your hand hygiene and all your steps are complete. So remember, at any point of your removal, when you actually encounter or you touch some if you feel your hands are contaminated or any part of your body, you need to do your hand hygiene. Now, how you go about reporting is, of course, all cases, suspected or positive cases, need to be reported to the 937 by calling 937, and they all get registered into the health electronic surveillance system. As described, all spontaneously breathing patients need to be swabbed by taking a nasopharyngeal swab, whereas in case of intubated patients, we recommend using a deep endotracheal aspirate. Now, these are, once you are done with your hand hygiene, wearing on your personal protective equipment. Also, if you see all our patients are directed through a respiratory triage. First, there is a checklist. If they meet a certain criteria or a score of more than 6, they are directed towards the isolation rooms. They follow the respiratory triage, and then they come to ICU. So there is a pathway by which a patient would reach ICU. Now, patient placement, it is recommended that all critically ill patients are placed in negative pressure rooms, okay, which are airborne isolation rooms. If you do not have facilities for negative pressure rooms, you can still afford to place some stable patients in a single room, but taking care that there is a HEPA filter, one at the end of the patient. Also, a logbook needs to be maintained regarding who is entering the room, because this would help us, especially during the contact tracing or when a healthcare worker is exposed to a positive patient. Now, what are aerosol generating procedures? As you see, tracheal intubation, non-invasive ventilation, tracheostomies, cardiopulmonary resuscitation, manual ventilation before intubation, bronchoscopies. All these are airborne or aerosol generating procedures. As a result of which, you need to put on all your PPE, which includes your Ebola suit, your N95 mask, and all the other PPE, as I told you. You will wear on, if the Ebola suits are not available, you will put on your surgical gown. Okay, this is because it is impermeable and fluid resistant. and this is very, very important. Make sure that all aerosol generating procedures are done in a negative pressure room, okay, where there are adequate amount of air exchanges that are taking place in the per hour. Now, as long as possible, we try to limit the movement of such patients outside the room. We use designated X-ray or portable equipments. We try to notify the receiving department if you're trying to shift them for any procedure or any such diagnostic procedure that you have to do. Also, make sure that the receiving area has complete information so that they take all their precautions, especially at the receiving end. And we also need to decontaminate, disinfect and clean all the surfaces of the patient. Now, as you see, we already have dedicated equipments, especially for the use of COVID patients, like our X-ray portable X-ray machines, our dialysis machines. All of these machines are dedicated. We also have dedicated an elevator, especially for the transport of such patients. Only you can see elevator which specifies that it should be used for COVID patients only, and so on. This is the transport capsule, which I have which I've actually posted onto the left side. This is mainly for the transportation of a COVID positive patient. Now, on your right, you see people wearing healthcare workers wearing Ebola suits, the N95 mask, and so on during the transfer of the COVID patient. So these are the transport capsules, which are mainly used for the transport of such COVID patients to other hospitals. Now, the transportation, as I already stated, you need to make sure that if the patient is spontaneously breathing, you need to put on a surgical mask onto the patient. If the patient is intubated, it's fine. But however, you need to make sure that you put on all your PPEs. You need to put on your Ebola suits if you need, or if they are unavailable, you need to put on your gown, your mask, your gloves, and so on. Okay. Make sure when you reach the other hospital, the endorsing hospital, you need to change your PPE there, wear on a new set of PPE, and then get back to the hospital where you started from. So these PPE are then removed at the EMS or at the point of entry of your hospital. Also, it is very important for you to make sure that we use dedicated equipments only. Carry as much less gadgets with you whenever you are working in isolation rooms. Make sure to disinfect your stethoscopes, your mobile phones, your spectacles, etc. after you have entered an isolation room. As much as possible, we try to dedicate equipments, but in certain cases where they are not dedicated, of course, we send it for disinfection and so on. So proper environmental cleaning and disinfection is ensured, especially terminal cleaning of such rooms is done. Fogging of such rooms with hydrogen peroxide is carried about. Frequently touched surfaces, especially the bedside rails, the monitors, all of this is taken care of. Now, there are other things which have also been specified, especially after the Wuhan outbreak that happened, or which started in the Wuhan seafood market. You need to avoid touching animals and animal products. Avoid consumption of raw, undercooked, and animal products is also being specified. Now, what happens when you get exposed to a COVID patient? Of course, you need to report to your direct supervisor and the infection control team. The management will mainly depend upon the infection control risk assessment. They would assess you based on whether you had a protected exposure or an unprotected exposure, or whether you have symptoms or you don't have symptoms. Based on that, if you are symptomatic, you need to stop work. You need to get your swab done, and then we would follow up your swab results, and then you would be notified from infection control and cleared from infection control to join your duty. Now, however, the observation period is 2 to 14 days. If you have been exposed to a particular patient, you need to observe yourself for 2 to 14 days for any signs and symptoms or for any clinical deterioration. Now, what if you are staying home, or if you have been home isolated? It is very important for you to do your hand hygiene before you do any kind of activities at home. Avoid visiting or avoid contact with sick people. Try to follow your cough etiquette or respiratory hygiene, and also monitor your health and your family's health. Now, what happens when we have patients exposed to a COVID positive case? Again, you need to monitor them for signs and symptoms. especially for the full incubation period, which is 14 days. If a patient is already negative, you need to follow him again for signs and symptoms for the other 14 days that are remaining. And you need to notify the infection control so that he could be traced and he could be monitored all throughout. So these were some of the things that I wanted to touch upon uh, very briefly. So if you have any questions, you can feel free to ask me any questions that you have.